Miryaya, Miryaya, Miryaya.
Care International says it reopened its mobile clinic in Bentiu last weekend after it was forced to suspend operations in the wake of violence. Care International Communication and Advocacy Officer Dan Alder told Radio Miraya's David Lucan that the mobile clinic is operating at the Catholic Church and that nearly 100 patients have already visited the facility.
CARE set up this mobile clinic actually back in mid-February. We had been supporting all the clinics in Rubicon County before the current crisis began, and our clinic that we were supporting in Bentiu was looted and partially destroyed during the initial phases of the current crisis. Basically, we set up the mobile clinic to kind of try to fill some of the gaps that were created by the lack of operation of the regular clinic. And they were seeing about 100 people a day, every day, between February and the most recent outbreak of violence 2 weeks ago. Because of that violence, we had to close down the mobile clinics also. And we were just able to get those back in operation, working out of the Catholic Church grounds there on Saturday. We saw 32 patients the first day, and as word got around a little bit more, and we were back out on Sunday, and we saw 70 patients.
So can you explain to me, when you say mobile clinic, is this like going around town, or you have specific places that you go to and then the people come to access your service?
All the services, public services in Bentiu were shut down, basically, when the conflict began. There is some services being offered out of the hospital there, but the other clinics have been shut down. So this is a clinic that happens in the same place every day at a church, and people who have trouble getting to the main hospital can come there. I was actually there on Saturday and Sunday to witness the reopening of that.
What exactly is this mobile clinic offering?
It's a walk-in clinic, and most of the problems that they're treating and they're seeing are directly related to the lack of public services and the extreme contamination of the environment. There have been bodies laying around Bentiu now for 2 weeks. There's no clean water available to people. They're having trouble washing and finding clean water to drink. As a result, almost everybody in Bentiu has diarrhea and is complaining of stomach problems. So we were getting a lot of those kind of cases. And then a lot of infections related to the contamination also. With all the flies, a lot of eye infections, skin infections, things of that nature. And a few gunshot wounds, the cleaning up of old wounds, the fighting. There hasn't been any real fighting there now for 2 weeks. And besides that, the kind of the normal caseload, of course, malaria is always a big issue.
You say you were there on Saturday, and what is your assessment?
The outlook is a little bit disturbing. We were also seeing several cases of severe acute malnutrition. I spoke to one woman, and she said she just couldn't get enough to eat herself, and so her child was suffering the effects of that because her baby girl wasn't getting enough breast milk. This problem with people not being able to get enough to eat is because of the disruption of the markets. Most of the cattle have been taken away to safer places, not so the women and children. These people don't have their normal coping mechanisms, just aren't there. And as this draws on and they keep having to flee into the bush or into the urine compounds, the resiliency is getting very thin. That's why we're so worried about the food crisis in this country.
That was CARE International Communication and Advocacy Officer Dan Alder speaking to Radio Miraya's David Lucan.